right, let me ask you something. Say you're waiting on test results from your doctor, and you get the notification that the test result has posted to your patient portal. Do you check that result right now, or do you wait for the call from your doctor? Better yet, what do you think most people would want to do? Well, now we have some great data to tell us what most people would choose to do, and the answer is overwhelmingly see the test result right away. That is according to a study that was just published this week in JAMA, the Journal for the American Medical Association. This was a study of the perspectives of patients about immediate access to test results through an online patient portal. We're going to take a closer look at that study right now. So recently there was this piece in Politico that outlined a professional disagreement between doctors and patient advocates over how good of a thing it was that patients now have immediate access to test results thanks to the 21st Century Cures Act. On one hand, doctors are saying that patients getting bad news through a patient portal without a doctor to walk them through it causes a lot of emotional distress and harm. On the other hand, patient advocates are saying that patients can and should be the ones to control information about their own health, but whose viewpoint is more popular. Fast forward to this study in JAMA. This was a survey of over 8,000 people recruited from 4 different medical centers in 4 different regions of the United States. And what's cool about this group of people is that they all actually had a test result pushed to them immediately through their patient portal sometime in the last year. These were not people just offering hypothetical opinions. These were people who had lived the experience of receiving an immediate test result before their doctor could call them. Now, some of the survey questions these people were asked were things like, what type of test did you have taken? Was the result normal or abnormal? And the big one, would you want to keep getting test results pushed to you immediately through your patient portal or not? So what do these people say? How many people, after getting a test result pushed to them immediately through their portal, wanted to continue getting test results that way? Get this, over 95%. Yeah, over 95% of people who had had a test result pushed to them immediately through their portal before their doctor could contact them wanted to keep getting test results delivered to them that way. And you might be thinking, well, how much of that is skewed by people who got normal results? What if we just looked at people who got bad news? And guess how many people who got abnormal results pushed to them immediately kept wanting those results pushed to them immediately in the future? Still over 95%. What? Yeah, still over 95% of people, even those who got abnormal results, prefer to get those results pushed to them immediately in the future. There's some other interesting stuff in this paper too. The researchers also surveyed folks about the level of worry they had after getting their test results, and they separated out levels of worry amongst people who got normal results versus people who got abnormal results. Now, I thought this was kind of an odd thing to do because to me, it feels inherently obvious that if you compare a group of people with normal test results and a group of people with abnormal test results, the people with abnormal results are on average going to experience more worry than the folks who got normal test results. And lo and behold, you can see that amongst the folks who got abnormal test results, a few more of them experienced the higher levels of worry than folks who got normal test results, which, like, no kidding. But that's not the interesting part. The interesting part is that if you look at all the people who got abnormal test results, the majority of these folks actually experienced the same or less worry after they got their test result. And I think this just goes to show how agonizing it is to wait for the results of your test. It's so anxiety-provoking to wonder what if, that just getting the test result back, even if it's bad news, can be such a relief because now you know what you're dealing with. Now, the researchers also looked at how worry was impacted by pre-counseling. That is, if the provider, like the doc or the nurse, explained to the patient why they were getting a test before they ordered the test. And that's kind of a bummer because when you look at the results here, you can see that for 2 of these sites, there actually did seem to be less worry experienced by folks who got pre-counseling compared to folks who did not get pre-counseling. But when you throw all 4 sites together, when you look at them in aggregate, there did not appear to be a statistically significant change in worry whether or not you had pre-counseling. So you kind of have to wonder, was the pre-counseling different at these sites? And if the pre-counseling offered at the 2 sites with less worry was fundamentally different / better in some way. All right, so what do we do with these survey results? To the docs and nurses out there, this is great news. This data would indicate that people getting test results pushed to them immediately, on the whole, causes anxiety to go down. They have less worry. And it appears that people do not regret getting test results pushed to them immediately, based on the fact that 95% of them want to continue getting test results this way. That's great. It looks like people do appreciate the chance to prepare their questions before talking to you and just get more of a game plan before engaging with you in decision making. For patients out there, I think this goes to show how much people appreciate that patient portal and all the data accessibility that it provides. So my call to action to you is set up your patient portal. I know we all have app fatigue, and I know some of these portals are better than others, but 95% of people appreciate having that portal and want to keep getting test results pushed to their portal. I think they're trying to tell us something. What I would recommend to you is next time you're at your doctor's office, before you leave, pause in the waiting room and see if you can get your portal set up. Make sure that you can easily get into your portal, and if you're having any trouble with it, pop back over to the front desk and see if someone at the front desk can help you get in there and get it set up before you leave. My second point for patients is please do not overlook the benefits of pre-counseling. I know that this study overall says it did not impact levels of worry, but I think there's something in those two sites that did show pre-counseling lowered levels of worry. What this says to me is that docs have not quite standardized what good pre-counseling conversations ought to look like. So you may need to guide that pre-counseling conversation so that when your test result gets pushed to your portal, you know if you want to open it right away and get to work, or if you want to wait for your doctor to call you and get to work then. Now, if you want some more tips on how to guide that conversation, check out this video next.